Good morning, everybody, and thank you for joining us. Hope you've grabbed your cup of coffee. For some of you, it may be your first, or others your third or fourth, depending on where you are, and that you're ready for this third part of our Medicare Morning Jolt webinar series. On behalf of my teammates in the Senior Health Department, Kristen Burke, Arlen Visser, and Thomas Flick, I am Rob Giambroni, and excited to present to you today's webinar about Medicare Advantage plans. Before we begin, I do want to let you know that there is an opportunity for questions and answers. To ask a question, just type it into the questions box there in your GoToWebinar control panel, and I'll be sure to answer any questions at the conclusion of the presentation. And also, you're welcome to visit the handouts section for downloadable materials regarding that are pertain to today's presentation about Medicare Advantage plans. So with that, I want to begin today's presentation with just an overview, a general overview of Medicare. Medicare is a social insurance program that was established in 1965, created to help those people who are age 65 and older, those who are disabled, or those who have permanent kidney failure. Currently, Medicare provides coverage to more than 62 million people. With nearly 10,000 baby boomers turning 65 every day in our country, this senior health market presents unprecedented sales opportunities. Medicare consists of 4 parts. There's your traditional Medicare, with Part A as your hospital insurance, and Part B, your medical insurance. Part C is commonly referred to as Medicare Advantage, and Part D is prescription drug coverage. Medicare Advantage plans must cover at least what Medicare covers, and they also offer additional benefits. Though beneficiaries still need to pay their Part B premium, it is often mentioned that Medicare Advantage plans replace original Medicare. This means that providers who accept MA plans submit their claims directly to the MA carrier and not to Medicare. Medicare Advantage plans cost zero to little premium per month in exchange for higher out-of-pocket costs like copays and co-insurances that can be capped anywhere from $34 to upwards of $7,500. Those who enroll in Medicare Advantage plans can only enroll or switch during certain times of the year. And Medicare Advantage plans are mostly network-based plans like HMO or PPO plans, but there are also non-network plans as well that will go into more detail during this presentation. We are realizing a tremendous increase in a surge in Medicare Advantage enrollments. As of February 1st of this year, total MA membership stood at more than 29 million beneficiaries. That's more than 46% of the 63 million Medicare beneficiaries in our country. This represents a nearly 20% increase since just February 1st of 2020, just before the pandemic began. A 2019 ruling by CMS helped fuel this surge in Medicare Advantage when it enhanced the model to focus as much on wellness as it does on health benefits. This gave many of the Medicare Advantage carriers more flexibility to expand their supplemental benefits to include more than just the gym memberships or vision and hearing discounts that are commonly available, and allowed them to expand to include programs like ride shares with Uber or Lyft or other similar ride sharing companies, and even allow their Medicare Advantage members to have access to wearable devices that can monitor your health, like Fitbits or even Apple Watches. This has led to what industry experts predict to a 47% penetration by 2025, and eventually up to as high as 70%. There are several types of Medicare Advantage plans. HMO or health maintenance organizations, PPO plans or preferred provider organizations, private fee-for-service plans, and special needs plans. Those in an HMO plan will receive their care from a contracted in-network provider, except for, of course, in emergency care situations, or if they have to go to an urgent care out of area, or for those who receive dialysis, they can receive dialysis in an out of area or out of network provider. Some HMO plans have a point of service option, which then allow for out of network care at a higher copay. With PPO plans provide care through a contracted provider network. However, it's very important to note that all benefits covered in network in the PPO plan are also available out of network, but at a higher copay. And PPO plans have maximum out-of-pocket costs for both in-network and out-of-network providers. With a private fee-for-service plan, those are more relegated to areas where networks are not established, like in non-metropolitan areas, where care can be available from any Medicare provider who agrees to the plan's terms and conditions of payment on a patient-by-patient and visit-by-visit basis. Very important to understand that those who are in a fee-for-service plan have to make sure that their provider is agreeing to those terms and conditions on each visit. PFFS plans can have a network of providers in some areas, and those network of providers have already agreed to always treat those plan members. Those who are in a fee-for-service plan do not need to select a primary care physician. As for special needs plans provide health care for certain groups of people, those who are receiving both Medicare and Medicaid, referred to as dual eligibles, and those are able to enroll in a dual special needs plan. Those who are residing in a nursing home or a skilled nursing facility can have the ability to enroll into institutional special needs plans. And those who have chronic health conditions like diabetes can get chronic special needs plans. It's important to note that some of these plans, like the institutional special needs plans, are not often able to be sold by independent brokers, but only directly to the carrier by the consumer. And I always recommend that for those who have clients that are residing in a nursing home or a skilled nursing facility, that they work with the case managers at those facilities to determine which plans that they work best with, so that the care and coordination can be as seamless and easy as possible for those in those situations. Those in the special needs plans must provide Medicare prescription drug coverage. Special needs plans may require primary care doctor or a care coordinator to help assist with the beneficiary's care. And in most cases, those in special needs plans need to get a referral to see a specialist. There are other Medicare health plans that are not as common, but are available in certain parts of the country. Medicare cost plans are available in certain but limited areas. And in general, those who may only have Part B, but not Part A, can enroll in a Medicare cost plan. And Medicare cost plans can be enrolled in, or you can leave them at any time of the year. A Medicare medical savings account is a high deductible insurance plan with a medical savings account that is used to pay for healthcare costs. Once the deductible is satisfied, then the plan will pay in full. Medical savings accounts do not cover Part D prescription drug plans, or coverage rather. So those who are enrolled in an MSA do need to then enroll in a standalone prescription drug plan. One of the confusing parts about Medicare Advantage plans that I often hear about is when can beneficiaries enroll in Medicare Advantage? The initial election period is 3 months before the month of their 65th birthday, the month of, and up to 3 months after the month of their 65th birthday. This initial election period also pertains to Medicare Part A and B and Part D. So for those who aren't for those who are not receiving Social Security benefits and therefore not automatically enrolled into original Medicare Part A and Part B, they would enroll during their initial election period, at which time they can also enroll in their Medicare Advantage plan. Many are familiar with the annual enrollment period when between October 15th and December 7th, when beneficiaries can enroll or disenroll from their Medicare Advantage plans or standalone prescription drug plans. There's also many special election periods available. Loss of employer group is the most common special election period when someone loses their credible group coverage. They have 60 days from that day then to enroll in a Medicare Advantage plan. There are several other scenarios that qualifies for special election periods, and I invite you to refer to the document that discusses special enrollment periods that's available in the handouts section. Lastly, there's also the Medicare Advantage open enrollment period that's quickly winding down here. It ends the end of this month. It goes from January 1st to March 31st of each year, when those who are enrolled in the Medicare Advantage plan as of January 1st, they then have a opportunity for a one-time election into another Medicare Advantage plan, or they can disenroll from their Medicare Advantage plan and go back to original Medicare and have a special election period to get into a standalone prescription drug plan. They could also then enroll in a Medicare supplement plan, but it's very important to understand that enrollment into the Medicare supplement plan is not guaranteed in most situations. And it's very important to make sure that for those who are considering this, that they have approval from the Medicare supplement carrier that they are going to be covered and approved for coverage. And once they are approved for coverage, then they can disenroll from their Medicare Advantage plan and then enroll into a prescription drug plan. Agents who are selling Medicare Advantage plan must certify to sell with each carrier they intend to sell each year and any carrier that they are receiving renewal commissions from. Certification consists of taking the AHIP exam, which includes 5 modules and a final exam that's 50 questions and required to score 90% or higher within 3 attempts. The AHIP exam costs $125, and we are very glad at Art Jetter and Company to be able to reimburse that $125 fee when the producers are issued just their first Medicare Advantage plan. Once the AHIP is completed, or the AHIP credits are transferred to the carrier, then brokers have to complete carrier's product-specific tests or attestations. Those who are new to Medicare Advantage may be wondering, how to go about in selling them and knowing about some of the compliance rules that are in place and how to do that, how to make sure that everything that you're doing is compliant so that you can take advantage of this tremendous sales opportunity. One of the main keys to success I have seen throughout my career at Art Jetter and Company is from agents who have a strong relationship with their regional sales manager. Regional sales managers are looking for dedicated, knowledgeable producers who they can trust to close sales and provide much needed guidance to Medicare beneficiaries in their communities. I've seen agents who foster these relationships do very well, and they've been rewarded with marketing and lead generating opportunities, as well as training. One of the most memorable experiences I recall is for an agent that worked in the Houston, Texas market. She really established that relationship with the regional manager and was given the opportunity to work and have a kiosk at a food pantry where she was able to guide the clients that came to the food pantry about affordable plans that were available to them. She's able to really focus on the dual special needs plans, and then was able to establish herself as a trusted source in the community for helping beneficiaries, not just the dual special needs market, but of all Medicare beneficiaries, because she really showed a lot of knowledge and developed a lot of good relationships with those in her community to provide guidance on Medicare. Producers can also put on seminars, and the seminars can either be educational or sales seminars. Educational seminars are ones that would provide an overview of Medicare and the kind of plans that are available, but can't be anything product specific or talk about specific benefits. It cannot present any carrier specific materials or enrollment packets. Educational seminars are important because it does show, again, and establishes you as one who has knowledge about Medicare and can provide that guidance that seniors are really clamoring for in their community about what plans are available for them and the choices that they should make. However, sales seminars can be most beneficial because they give you the opportunity to present carrier specific plans and benefits, and you can accept enrollments during these seminars. It's important that if you do choose to do a seminar, that you file them with the carrier that you're going to be representing, and the carrier will then file it with CMS. And these need to be filed anywhere up to 3 weeks in advance of the date of the seminar. An informative website and social media presence is also very important. Many reports and studies indicate that a majority of seniors, those either nearing 65 or who are already Medicare eligible, are looking to Facebook or other social media platforms for recommendations on trusted advisors in their area. They're also asking their friends, of course, but an informative website and strong social media presence can show those in this market that you are nearby and can be relied upon for to answer and provide trusted Medicare guidance. For those that don't have an online presence, it's important to note that you're losing out on an opportunity to reach out to potential clients in your immediate area. We're very glad at Art Jetter & Company to partner with Ken French. Ken is a professional web developer and social media expert who only works with independent insurance agents. Ken used to have his own brokerage agency and then sold that to go into and dedicate his profession to building compliant websites and social media pages for insurance agents. Name of his company is Snoozy Inc. And be sure to visit our microsite, jetter.snoozy.net, for further information and just showing pricing that includes a discount that's available specifically for agents with Art Jetter & Company. The scope of appointment form is a necessary part of Medicare Advantage sales. It's essentially just a consent form. And throughout my time in my career, I've seen some agents who are concerned about, and they get kind of burdened by the scope of appointment form. When do they have to present it? What does it mean? So a scope of appointment form, again, is a consent form where Medicare Advantage beneficiaries essentially just consenting to the products that you're going to be speaking to them about. It's necessary for Medicare Advantage and prescription drug plans, but also has a space on the scope of appointment form to check for Medicare supplements, hospital indemnity plans, and dental, vision, and hearing plans as well. Also of note, CMS has become a bit more lenient on scope of appointment forms in the recent years. It used to be mandatory that the form needed to be completed 48 hours in advance of the appointment, but now it's more common to complete it at the time of the appointment, though 48 hours is still recommended. And also, scope of appointment forms don't necessarily check with your specific carrier as to whether or not the scope of appointment form needs to be submitted with the applications that you're submitting, but also know that scope of appointment forms do need to be kept on record for up to 10 years. Above all else, in your marketing efforts, it's important to remain compliant. And I refer again to the handout section that includes a summary of the Medicare Advantage and Part D marketing rules. That's just a one-page summary that really provides a great summary of the necessary ones that you should be most aware of. We offer a very competitive portfolio of Medicare Advantage carriers here at Art Jetter and Company, to include Humana, United Healthcare, Aetna, Cigna, and WellCare. Humana has an excellent commitment to the veteran population. United Healthcare is the largest Medicare Advantage carrier in the country and is co-branded with AARP. With Aetna is part of CVS Healthcare, and Cigna has their Medicare Advantage plans are branded as Cigna HealthSpring. And WellCare recently was acquired by Centene, so WellCare is a Centene company. And all of these carriers have Medicare Advantage and prescription drug plans available. And of course, United Healthcare, Humana, Aetna, and Cigna, they also offer Medicare supplements and other ancillary benefits like dental plans. As we wind up this presentation, it's very important for us to make sure that you're aware that we have an excellent tool, an essential Medicare coding and enrollment tool available called Trusty Select Pro. That came about originated back when in 2019, when Medicare took away the agent's ability to save beneficiaries' drug lists on Medicare.gov. We then knew that we needed to come up with a viable solution that allows our producers a simple means to run accurate prescription drug and Medicare Advantage quotes and comparisons. Our management team worked with Trusty.care, who developed this tool called Trusty Select Pro that allows you to run quotes for all of the MA carriers available in your area, regardless if you or we at Art Jetter & Company are even appointed with them. Producers who have access to our tool, we allow our producers who are appointed with any of our carriers to provide free access, allowing you to run comparisons for up to 5,000 beneficiaries in just minutes. You can receive notifications for both beneficiaries then who should change their plans or those who should stay in their current plan. This really helps reduce the time during the busy annual enrollment period when producers have been accustomed to having to enter prescription drugs for each of their beneficiaries one at a time. When you enter your client's information into the tool, you can actually import their medication claims data and their list of prescription drugs directly from the beneficiary's MyMedicare.gov account with the Blue Button 2.0 integration technology, which again allows beneficiaries to import and save the current drug lists in just seconds. So therefore, when you're saving this data into the Trusty Select Pro platform, you have it there continuously and can update it and not have to re-enter their drugs during the next AEP when they're going to be shopping for other plans or determining whether or not the plan that they're currently enrolled in is going to remain the most viable option for them in the new year. So with that, that concludes the presentation this morning about Medicare Advantage plans. And again, I welcome, open it up to any questions that anybody may have. And let me check to see if what questions we might have. One of the questions I see is regarding prescription drug plans. So Medicare Advantage plans, most Medicare Advantage plans do include both Medicare Advantage and prescription drug coverage, but there are some plans that do not. If somebody's enrolling into a HMO plan without prescription drug coverage, it's important to note that they cannot enroll then in a standalone prescription drug plan, and that they would have to then get their prescription drug coverage from somewhere else. These types of plans then are mostly relegated to like veterans in our community who would get their drug coverage from the VA and get their health benefits then from the Medicare Advantage plan. We also have standalone prescription drug plans available with these carriers, in addition to the carriers that were mentioned in this presentation. Mutual of Omaha is another one of our main carriers that also offers standalone prescription drug plans. So if anybody else has any other questions, you're welcome to answer those, but welcome to enter those questions into the questions box, and I'll be sure to answer those. But if you think of questions later on after this presentation, you're welcome to email us at seniorhealth@jetter.com or give us a call at 800-228-0008. And you're welcome to speak with your selected senior health specialist, either Arlen, Thomas, or myself. And also, today's presentation is being recorded, and we will be glad to send you out a recording of it as well. So again, everybody, thank you so much for joining us this morning, and we appreciate your business and hope you have a wonderful rest of your day. Thank you so much.